and one other as to what we will name this. Metaflammation is one, smouldering inflammation is another, which I like because it sort of gives you this connotation of inflammation in acute disease being like a fire. This is more like a smouldering inflammation. It's lower level but goes on much longer. And the other one is as paraflammation, which is near to inflammation. So who comes up with the term is going to become famous for the rest of their life. So just in summary, the difference between these two systems, you've got classical inflammation here where it's a microbial pathogen or an antigen that causes an inflammatory reaction which causes the immune defense system to respond. Sorry, and then you get resolution back to basal homeostasis. This other type of inflammation, metaflammation, is much slower. It's not an antigen as such. In fact, the term that's been used is an inducer, which causes a disruption through the mainly through oxidized LDL in the endothelial tissue, which then leads to oxidative stress, to metaflammation, insulin resistance, goes on to dysmetabolism and disease. And the thing about this is it doesn't resolve. It's chronic. So you get chronic allostasis, which is the opposite to homeostasis at that level. This now seems to explain the chronic diseases that we are seeing. So we go back and look at the graph that I showed you before, the changes that happen with development. And the best example of this at the moment is China and India. You can see they've had this rapid drop in acute diseases, and the drop in acute diseases, by the way, occurs largely because of changes in hygiene and nutrition in particular. It comes after, and it did in Western society, it came before, the invention of penicillin and the sulfonamides and so on. So it's a lifestyle-based prevention, basically, if you look at it that way. On the other hand, we get this rise in chronic diseases, which, if you think about it, is quite natural with economic growth. Because if we don't consume more, the economy doesn't grow. And if we don't consume more by eating more and driving more cars and not walking, we get fat, but the economy gets healthy. That's the paradox. This is the whole paradox that we're seeing here. And ironically then, it's the classical immune system that has dealt with acute diseases right throughout human history. It's now this low-grade metaflammation which we are targeting because it's affecting the chronic diseases, the lifestyle-based chronic diseases. So, low-level systemic inflammation, also called metaflammation or paraflammation or smouldering inflammation, underlies most, if not all, modern chronic lifestyle-related disease, such as heart disease, diabetes, and even many forms of cancer, we know now. If you want to follow this up, there was a supplement published in Nature in September last year, which is all about this inflammation. Metaflammation, therefore, is to chronic disease what classical inflammation is to infectious disease or injury. Now, what causes it? What are the inducers? And we know we can measure this because we can measure the pro-inflammatory cytokines, that is the messengers, that we can actually measure it acutely. You do the behaviour, then you take a blood, and then you measure this. And you can see that these pro-inflammatory cytokines go up, or the anti-inflammatory cytokines go up, which means this is good. It's reducing inflammation. It's because life is a balance between anti and pro and anti-inflammation. What causes the pro-inflammatory cytokines? What causes inflammation at this level? All of these things. And John and I have listed all these again, and we've just done a review on all this for the nutrition reviews. Obesity, nutrition, and different aspects of nutrition in here: inactivity, smoking, sleep deprivation, stress, depression, passive smoke, pollution, all lifestyle-based causes. Now, you look at the other side, the pro-inflammatory responses, nutrition. All the things that we have known for a long time are good for us, including the Mediterranean diet that Norman pointed out, including the aspects of the Mediterranean diet. And I agree totally with him. Taking nutrients out of the Mediterranean diet is not going to be effective, just like taking oil out of fish is not going to be effective necessarily, although David Cahoon will disagree with that tomorrow morning. Depending on the type of oil, I think we could say, David, is that correct? Yes. I've got the chair tonight, though, anyway, so... if you look at the difference then, if you did a factor analysis, the psychologists are good at this, do a factor analysis and work out what's the underlying factor between all of these things here and all of these things here. And it seems quite clear to me that the underlying factor is all of these things have been around for thousands of years. All of these things have only been around since the Industrial Revolution. So we're talking about the human body reacting to new behaviours, lifestyles, induces, as it would in the past to a bacteria or a virus. But it's reacting to it at a much lower level, causing this metaflammation rather than acute inflammation, and return back to homeostasis. Now, we tested this hypothesis just recently, and this hasn't been published yet. This is the first time I've shown these data at all. And what we did is we got patients at Sydney University, I had a master's student do this, to eat kangaroo for breakfast, one meal. Breakfast is always easier because they're fasted overnight. And then the next week they ate Wagyu beef, which is the fattiest type of new beef. It's only been around for the last 10, 20 years, Wagyu beef. It's about 30% fat. It's not bad fat, by the way. It's got quite high monounsaturated fat. But because it's such a new type of meat, our hypothesis was that human beings as a whole have evolved being used to eating lean game meat. Not necessarily kangaroo, because Aborigines have eaten that, but Europeans, of course, haven't eaten kangaroos, but they've eaten similar lean game meat. So the human body has evolved to, has adjusted to that type of meat, whereas it hasn't adjusted to the Wagyu meat. So the hypothesis was that the pro-inflammatory markers would go up immediately after the meal. Unfortunately, we had no money to do this, so we did it all on with nothing, and we measured IL-6, TNF-alpha and C-reactive protein, which are the three major measures of inflammation. And you can see here, this is what happens when you eat the kangaroo. You get a bit of a rise because all food causes a reaction from the immune system, even healthy food. And in fact, interestingly, the more you eat at one meal, that becomes a very pro-inflammatory reaction if you eat a large meal at one meal. But you see here, they keep going up, and TNF and IL-6 would probably keep going up and then start coming down after about 6 hours. But the limited data that we have here shows quite clearly that the body responds differently to these old foods versus these new foods. Now, the anthropologists have been saying this for years. They've been saying that the foods that we eat now are not healthy for us because they're processed and they're different and so on. But they haven't had the data to prove it in this sense, and we've only known this since we've started working on inflammation like this. CRP is a much more acute phase marker, so it goes up quickly and starts to come down. And so you would expect that sort of curve up there. Everything is ideally placed to what we would expect. The only problem is that we weren't able to do it for 4 to 6 hours because we didn't have the money to do that. But that's the next stage to doing that now. So, just to summarise this section, what we're saying now is, and agreeing totally with Norman, that obesity is not necessarily the issue. It may be the issue in some cases, but what is the issue? It runs through metaflammation. What is the issue is the things that may or may not cause obesity. Now, smoking doesn't cause obesity, but it still causes metaflammation, and it still causes chronic disease down here. The same way up here, drug use, over-exercise. And if you look at the data, which we've done, we've summarised all this, people who run the Hawaii triathlon have a huge rise in their pro-inflammatory markers for the next 2 weeks. The body is not used to that level of exercise, so over-exercise is just as bad as under-exercise in that sense. And all of these other things here, as they may run through obesity, they may not. Now, again, there's a huge body of literature just developing in the last 2 years looking at what's called inflamm-aging. And inflamm-aging suggests that inflammation develops with age, irrespective of what we do. And it's largely responsible for chronic disease in age. I mean, the suggestion is that we were probably designed to live for about 40 or 45 years historically. But living older, we have this greater tendency to develop inflammation right throughout the system. Those people who live a healthy life early in their life tend to have less inflamm-aging later in life, and vice versa. Those who don't live a good, healthy life tend to have more inflammation later in life. So inflamm-aging is another component of this, which is going to become very popular in the near future. And we know that this can be reversed as well by lifestyle changes, just as other changes there. So is there an underlying biological basis that's essential that's essentially a behavioural environmental etiology of chronic disease? Yes, it's this low-level systemic inflammation, and I think I made a mistake by not taking that previous graph out, previous figure out. But metaflammation is to chronic disease what classical inflammation is to infectious disease or injury. Now, I'm going to take a very bold step here and go one step further, and I've done this internationally, and I've also published stuff on this, by suggesting that inflammation as a reaction to injurious agents is a reaction to injurious agents characterised by disturbed function. And it can be both biological or you can use